Hi, thanks again for joining us in the Range of Motion Department for our Injury Prevention Series. This series is meant to inform and empower you on important information that will keep your body safe in and out of the gym. Here to help us discuss an area of the body that is highly susceptible to injury is physical therapist Keisha Hutton. The shoulder, otherwise known as the shoulder complex, is an area prone to overuse and injury. Here to help us better understand the issues that come about with the shoulder, injury preventative exercises, and also to understand when we may need professional help, we have Keisha. How you doing, Keisha?
Hi, Damien.
Good to see you again.
Nice to see you as well.
So what's going on, Chris?
Well, every time I'm at the gym and I'm doing any shoulder presses, I feel a pinch right in here.
You know, I hear that over and over again. I know a lot of people at the gym, they definitely work out hard and things like that, and eventually feel it. Golfers, same thing. So can you give us an idea of where these shoulder issues may come from?
Well, let me talk a little bit about the shoulder complex.
That'd be fantastic.
Okay. Here I have a picture of our model of the rotator cuff. On this model, of course, Chris, some of the muscles are removed. The pec muscles, or your anterior chest muscles, your deltoid muscles, and even some of your superficial back muscles are removed. So this is good to show the four rotator cuff muscles. In the front, we have the subscapularis, and in the back, we have the infraspinatus, teres minor, and supraspinatus. And this is actually one of the more commonly injured rotator cuff muscles. To go over a little bit about the actual joint, it's called the glenohumeral joint. It's made up of the humerus, which is up here. Okay, this is the arm bone, that's right here. It's called the ball and socket joint. The ball is actually the head of the humerus, and the socket is the glenoid. You can't see it from this model, but it's a very shallow groove. And the glenohumeral joint is also surrounded by a lip of cartilage called the labrum that helps to keep congruency. Now, the shoulder joint is extremely mobile, so it's highly susceptible to injury. So it's very important to do the proper exercises, stretches, and training in order to decrease risk of injury. Okay, some of the movements that the rotator cuff perform are, I'll have you stand up for this. Internal rotation, external rotation, okay? And also it can assist with, those are the main movements, it can assist with adduction or adduction, and it can also assist with extension, okay? Some common injuries that occur are impingement, and I'll bring the model out again to explain, okay? This is actually a model of the right shoulder. So as you can see here from this angle, impingement occurs when one of the, or a couple of the tendons of the rotator cuff become impinged or compressed under the acromion. And the acromion is part of the scapula right here, okay? When the arm abducts or goes away from the body, like this, the rotator cuff can be impinged, okay? Another common dysfunction of the shoulder is a rotator cuff tear. That could happen suddenly, like an accident, or it can also happen progressively. And impingement and tendinitis, which can turn to tendinosis, which is just a prolonged form of chronic tendinitis, can also lead to tear. Something else, another injury that can occur is a labral tear. I'll bring the model back again. And it's not pictured on here, but just for orientation, the labrum is a lip or a rim of cartilage that surrounds the glenohumeral joint. The glenohumeral joint is a very shallow joint, and the labrum actually deepens the socket, okay, to make it a little more sturdy. A tear with the labrum can, of course, cause more instability within the shoulder. So it's very important for proper training to make sure you have proper positioning and that you strengthen your rotator cuff and that you develop proper muscle balance.
Well, yeah, I think that's a great idea. So, Chris, I think one of the biggest questions you have is like, what exercises should you be doing? Obviously, the exercises in the gym, they're good for certain parts of the muscle, but as Keisha's alluding to, we really need to work on those small muscles that help stabilize that joint. Keisha, can you give some more insight on some good exercises that he can do, or exercises you recommend in therapy for conditioning those areas?
Sure. There's actually a syndrome that's very common, and most of us have experienced it if we sit at desk jobs, or if we do, overtrain our chest, which a lot of men in the gym commonly do. It's called upper cross syndrome, more commonly known as rounded shoulders. And what that is, if you can stand up, Chris. The shoulders are rounded, so the anterior chest muscles are shortened and tight. I'll have Chris turn around. The scapular stabilizing muscles are elongated and
Okay.
weak. And even the cervical muscles can be involved, like our levator scapulae can be shortened and tight, and even our cervical flexors can become inhibited.
So basically, if all these things stay in place, the spine's out of order, a lot of pressure back there, what other issues can come about from this poor posture, in other words?
You can turn back around. A variety of issues. You can develop cervical pain, you can develop shoulder pain, you can develop other forms of, it can even go into like low back pain if it progresses that further.
So basically you're saying there's a little imbalance going on here. It's too tight up here, too lacking a little bit of strength back here. And also the tighter this is, the harder it is for me to keep those shoulder blades back in position. So we can do some balancing exercises, stretching right here, and really condition those scapular muscles.
Exactly. So scapular stabilizing muscles, which I know you actually, when you train a lot of your clients,
Sure.
you really reinforce that. Making sure you can turn around, Chris. Making sure the shoulder blades come down and back.
Absolutely.
Okay, and of course, stretching the anterior chest muscles will actually help with balancing that.
Sure.
When it comes, if we have Chris turn to the side, when it comes to the rotator cuff muscles in this syndrome we're talking about, the slumped rounded shoulders or upper cross syndrome, external rotation is extremely important.
Right.
However, external rotation, you want to perform that with proper positioning, proper abdominal positioning, scapular
retraction, sure.
retraction, depression, and a lot of external rotation.
Okay.
Now, for example, say Chris performs a lot of chest press,
Yes.
a lot of lat pull down.
Yes.
That can really encourage rounded shoulders just from the origin and insertion of those muscles, the pec muscles, the latissimus dorsi. So he wants to make sure he works on his scapular retractors and depressors, and also make sure he stretches. It's fine to work the chest and the back and the lats, but you also want to make sure you have that balance.
I got you. I hear you. And that's a good lesson for everyone out there. Balance. I think we got some good information, fantastic information. I think we can use some of what she's saying in the gym to help you acquire more balance and get a little bit more conditioning in those scapulas. Okay. So let's get right to it. Let's get to the gym.
Okay, so we have Chris here, and we have determined that Chris needs to work on his external rotation. In the beginning, you want to make sure that he's in proper position. Shoulder blades are down and back, elbow is at his side, and we have a towel here to make sure he's in proper placement. He wants to externally rotate, come in. He keeps his wrist in a neutral position, and his shoulder blade remains down and back. Okay, so what Chris is working on doing is external rotation while maintaining scapular, this is a scapular retraction, which is pulling in, and depression, which is pulling down. Okay, Chris is performing external rotation correctly, but I would also instruct Chris in the proper methods of performing shoulder stretches, including anterior chest stretching, and he would use guidance from his physical therapist or athletic trainer to perform these exercises correctly. Okay, now Chris is pulling this towards his chest. He's performing internal rotation. Even though he's performing internal rotation, it's important for him to maintain proper scapular retraction and depression.
So Chris has definitely mastered those single joint motions. So we're going to give him a little bit more advanced technique right here. For those of you out there looking to burn a lot of calories, but looking to kind of definitely strengthen your body and make it more proportioned and also balanced to prevent injury, this is a great exercise for you. I definitely recommend some coaching, so definitely check into the other part of our range of motion department and get this technique down. But here's a little preview. Chris is going to do a little retraction to begin with, and then we're going to advance the motion. So go ahead and take a squat position, Chris. So with this one, he's going to keep his shoulders down, okay, and he's going to work on retraction. Go ahead and pull those elbows back, Chris. Good, then go. And pull back. And give me a hold back there for a sec. Good, slowly down. And pull. Keep that midsection tight. This exercise is kind of deceiving because you really have to brace that midsection. Good. Excellent. Okay, so now what we're going to do is he's going to pull back, and now he's going to externally rotate. Good. Come down. Good. Pull back to begin with. Now retract. Good. Absolutely. Good. A couple more times. Good. One more time like that. Good. Now spread your feet a little bit more, Chris. Now we're going to squat down to begin with. So squat down first, all the way down. Come all the way up. Pull back. No, you're good. Squat up. No, squat up to begin with. You're going to squat up. Now pull. Rotate. Good. Arms in front. Squat down. Come up out of your squat, pull, retract, good. You got it, good. 2 more times. Come up, pull back, externally rotate, good, last time. And up, pull back, externally rotate, good job. Break, good job, good. How'd it feel?
Good.
All right, very good. See, he's very red, very tired. That's what you want to feel.